I'd like to introduce you to Danielle Robertson from DR Care Solutions, who will take us through the holistic care planning for carers in the workplace. Thank you, Danielle.
Thank you, Mary, and welcome everyone. I would just like to start by acknowledging the traditional owners of the land on which we meet and pay my respects to the elders past, present and emerging. So just next slide, thanks. So my goal in life is to assist every Australian to find the right care, support and accommodation for their ageing or disabled loved ones in the quickest and possible time within their financial capacity to pay. So it's the holistic approach of helping families and carers find that right care. Next slide, please. So what does the current situation of ageing, care and living look like for your loved ones? There's 2.7 million carers, which is actually 10% of the population, who are caring for the informal carers. So they're not paid, they're caring for others in Australia. If you were trying to find the right care solution for your loved one, it can take up to 190 hours of your life to try and work the system, understand what's right for your loved one. So it works out at about 190 hours off work to try and manage that process. It works out about 5 weeks. There are options to help families so that the employees don't need to take time off work. And not surprisingly, 70% of carers, primary carers, are females. And 1 in 3 are aged between 45 and 65, typically when women are entering or are in the executive stage of their leadership careers. Accessing and understanding the system is complex, time-consuming, overwhelming, and often frightening and intimidating. And particularly if your loved one has a life event and that you're actually working very hard trying to manage your workplace and manage the caring responsibilities at home. 1 in 6 employees over 45 will be impacted by ageing care responsibilities currently. Caring for the carer is key to be able to enable people to remain the primary carer and for many people to remain at home. Next slide, please. So what does the ageing, current and future ageing cares look like for you and your loved ones, the future? We see that 23% of the population will be aged over the age of 65 in 2026. Pretty scary, less than 4 years away. Most people want to age at home, and this is on the increase. Most people you ask where they want to age, it will be at home. But we see what's going to be happening is it's likely that those people who have money or assets behind them are going to have to contribute to their ageing care and living needs. The Aged Care Royal Commission recommendations mean that we have more than 10 years of complexity supporting the need for families to plan ahead before a life event intervenes. There's massive changes in the industry. It's going to take time for this to all work through, and not all the recommendations will be implemented, so it's going to take time. The aged care system changes focus on allowing many more people to remain at home with home care, and there's new models of care coming into the systems as we speak. Every week, every day, there's new models of care, innovations to support our families and carers living at home. And the ageing conversations are becoming increasingly normalised across families. Previously, not many people would like to talk about ageing or care needs or support in the home. It was always hushed and just dealt with within the home confines, but people are actually talking about this now. Next slide, please. So what we've done some investigations as to workplace best practice for carers, so the employees and employers. And there's no doubt that it's tough being employed in the paid workforce as well as being a carer for a family member who needs care. Working while caring gives you an income, which is great, and connection with other people. It also gives you a break from caring. It gives you external interests and general life satisfaction. It just gives you occupation as well, but it's also engagement. For employees, it's actually giving you the opportunity to speak with your peers, your collegiates, and have those discussions. It's using resources and flexible leave provided, and have the agreement with your employer gives you the bargaining power, not bargaining power, but to work with your employer to make sure that they understand where you're at. For employers, flexibility in working hours to fit in caring responsibilities. And we're seeing this more and more, that employers are becoming more aware that there are people who are carers in the workplace. Many a time, probably 5 years ago, it was always just people taking off personal leave or sick leave without actually explaining to their employer that they needed that time off to care for someone else. It's providing care support services such as Care and Living with Mercer, which is an innovative new platform that we'll talk about a little bit later. And it's encouraging normalising of understanding and support for carers within the workplace. And it's ensuring that your line manager understands and receives training in supporting you as a carer. And it also works with your team to understand that they understand how to support you as well. And it's participating in best practice citations to progress policies and practices within the workplace. Next slide, please. So what options are available for carers who are in the workplace? You know, we have to think about people who have never even reached out to an external source as to what sort of options are out there. There's home care, there's support services, there's entry-level support services. There's retirement communities. If you're leading into retirement, you might be in your 40s or 50s and starting to think, where do I want to age? So there's options around retirement communities. There's group homes. They might be specific for someone with a disability, or they might be for someone with dementia, living with dementia. There's special disability housing. There's supported independent living housing. There's residential aged care. There's palliative care and end-of-life care, which usually takes place either at home, in a residential aged care setting, hospital, or hospice. So what's the process for you to go through? And this is what we recommend, that people start the process as early as possible. If you're over the age of 65, or if you're caring for someone that's over the age of 65, they need to be thinking about getting into the government system. And that is for government funded support and care. You can enter into My Aged Care, which is a government portal that allows you to register and then be assessed. And this could also be for NDIS. If it's for NDIS, you go through the NDIS. If it's for anyone over the age of 65, it's through My Aged Care. So anyone under the age of 65 can go through the NDIS process. They run parallel together, but they are different funding models and different assessment processes. So with My Aged Care, there's usually 2 or 3 assessments that need to take place. There's an entry-level assessment, and that's for Commonwealth Home Support Services. And that's very entry-level. It might be domestic support, it might be some cleaning, it might be some meals, transport, that sort of thing, social integration and having social support, as well as, you know, maybe some gardening and maintenance of the home. That is not means tested. Towards the next level of care and support into a home care package, you need to be ACAT assessed. There's 4 levels of home care, and that is means tested. So it's just knowing which way to go and which way is going to be right for you. Once you get your support plan or your ACAT report, that gives you an idea of what level of funding you can receive or the number of services that you can have. And that will help you get some funding for the care or support services. You might need to look out for carer financial supplements, which always helps. They're not a huge amount of money, but it does help. And selecting an approved provider and then commencing services and making sure that you're getting the right amount of services for your particular loved one and to support you to remain working and caring for your loved one as a primary carer. You can always start immediately fee-for-service, private fee-for-service care and support, but just make sure you do your due diligence to pre-vet an approved provider. Make sure you're happy with them. Make sure you're happy with the carers. You choose your days, your hours, and the services you require. And then you can commence services, but it comes out of your pocket. Next slide, please. So the biggest challenges for carers that we see, and this is not just in the workplace, but everywhere, is lack of sleep, time out, and carer burnout. And what we always say is you've got to care for the carer, otherwise we've got 2 people we need to be caring for. So obtaining funding and external support, and don't be afraid to ask for it. A lot of people think that they're weak, that they can't manage this process, but there is support and care out there that we can help you with. So using external providers for home care providers, and you know the concerns around COVID-19 have been quite rife. What we've seen is that some people have put home care on hold, Others have increased, but they've actually reduced the number of carers that are actually coming into the home. So they might have had 3 or 4 coming through, so they might just be having 1 through COVID at that time, just to make sure that services continue. Obviously, if it's 24/7 care, you're going to have a team of carers, but what we tried to do was minimise the amount of homes that they were going to, so that they'd just continue with their one client to reduce the rates of infection. And also having the availability to undergo additional carer training and education. We're finding that's a real challenge, that a lot of carers want to understand what's happening to their loved one, what's the progression of the disease, what are the likely strategies for behaviour and that sort of thing. So they would love to be able to do training, but they just haven't got the time, and particularly if they're working full time. And just allowing others to help you and support you. You know, it's not feeling guilty about putting your hand up saying, I need a break. I need to go for a walk. Could you just please come and, help and support me? Using, your peers at work, talking to friends and family to support you through that process. That's one of the biggest challenges that we see. And carer stress is common. So find an advocate to be an intermediary in the workplace if you're finding it really challenging. As I said before, we need to be caring for the carers to avoid the other person being cared for and the carer needing care. And as we always say, it's fit your own oxygen mask first and your life jacket before assisting others, so that we've got to be able to protect ourselves to be able to support you. Next slide, please. So things to think about now: where do you want to live? And this is for carers. Does it need modification? And this is for carers who are caring for others to check that the house is safe. Who do you want to have caring for you? And this could be for yourself or your loved one. Educate yourself on possible issues that you have. You might have health issues or a decline in cognition. Reach out to carers support groups such as Carers New South Wales, Carers Australia. Register with My Aged Care or NDIS, and there's plenty of resources there. Investigate carer support and financial supplements and personal support. Obtain some quality financial advice. We always recommend this because everyone has a finite amount of money, and it's good to know how you can actually capitalise on that and make sure you're making the most of that, spending those funds. Also, estate planning. Make sure you've got your estate planning in place. And I can't speak strongly enough about having this. If you take one thing away today, it's making sure you've got your estate planning in place. And that's not just your will. It's around powers of attorney. So that's for someone to make a decision on your financial situation if you have lost capacity. Your enduring guardianship, and that is for your health care and accommodation decisions if you happen to lose capacity. So those documents are absolutely key. And there's another document that you can think about, and that's an advanced care directive. And that's like an end-of-life plan. If you're on life support or you can't communicate your wishes, what is it that you want? And it's usually a one-pager that your GP or a lawyer can help you with. So those documents are absolutely key. And plan knowing that a life event is highly likely to occur. And if it's not with the employees, who's the carer? It could be the person who you're caring for could have that life event, and then things escalate and get out of control and you need to bring in extra support. So just being aware of that. Next slide, please. So things to think about also in the future, having the conversation, and we highly recommend that being open and honest to your peers, to your family around having those discussions. Be frank, open, and document your wants and wishes. We feel that that works really well. If something happens, you've already documented it, everyone's across it, it's not a surprise, or the family don't have to run around to try and work out what that person's wants and wishes are. Who do you want to be involved in your care and support? Financially, physically, emotionally. Who do you want involved in that? Involve and discuss with trusted advisors and medical practitioners or specialists around, what do you want? What's your care going to be like in the future? What's it going to be like towards end of life? Supporting the primary carer financially, physically, and emotionally. Continue your education through research, learn coping and caring strategies. And there's amazing resources out there. If there's a cognitive decline, Dementia Australia, Hammond Care, there's a lot of places that have got a lot of resources. Carers Australia, Carers New South Wales have got lots and lots of resources. So just tap into some of those. And once again, estate planning and financial planning reviews. Make sure that that's done on a regular basis to make sure that the executor's still alive, that the powers of attorney and enduring guardians are still alive and cognitively sound. So things need to be reviewed on a regular basis. And start thinking about developing an end-of-life plan and getting your affairs in order well before a life event occurs. It just makes such a life easier for everyone else around you if everything's documented. Next slide, please. So we've developed this through Mercer. We've developed a wonderful digital platform called Care and Living with Mercer. And it's a digital platform to do it yourself, planning ahead right through to end-of-life care. And we've developed it based on, it's a critical service supporting you and your family for support, care and living throughout retirement, even before retirement if you're planning. Helps you understand the basics of aged care. It provides you with a free personalised roadmap for your particular situation and a roadmap review service. And you can access further paid support through premium services of our Care Concierge team. So we can help you and your loved ones live their best lives. Next slide, please. And how Care and Living with Mercer supports you. There's the digital portal, which I just mentioned, that's got the key features of personalised roadmaps to guide do-it-yourself approach in aging care. There's an information library and resources, just copious amounts about your well-being and different types of care available and living arrangements. And then there's one complimentary roadmap review with each roadmap created, and that's a very personalised approach to your particular situation. The benefits, it simplifies the process of finding care and living arrangements and using a friendly web-based design and enhanced accessibility. And there's 8 different roadmaps, as I said, from planning ahead right through to living at home with a little bit of support, living at home with a lot of support, right through to retirement communities, residential aged care and end-of-life planning. And the Care Concierge service is a professional paid service through our Care and Living with Mercer team. And we assess, plan and implement and monitor care arrangements and support you on that basis. Takes the stress away from having to do it yourself. I suppose if you're doing the roadmap and you get to a point and go, oh my gosh, there's just too much to take in and too much to do, you can call upon an experienced care concierge to do that. We've got experienced healthcare professionals who are in the team, their occupational therapist background, and aged care professionals who can help you with many. I think we've got 100 years of experience between the 4 of us at the moment, so that's fantastic. The helpline, there's a helpline to talk someone through to provide guidance through the portal and the roadmap process, referrals to the Care Concierge, and you know, we're a great empathetic team, experienced to help you and guide you through home care, retirement living, into residential aged care. Next slide, please. So I don't know whether I'm going to have much time to actually go through the case studies, but look, what we can do is help people who, well, we have done, we've helped clients out of residential aged care back home with 24-hour care support during COVID. The family were very concerned about not being able to access and see mum and dad, so they actually brought them back home, and it was for a period of time. We knew the father was terminally ill, the mum had cognitive decline, so we actually did that and got that happening in place. We pulled a 95-year-old out of hospital back home with 24-hour care in place with quality care. We've got her back to a point where now she can actually be at home overnight, and she's only having 12 hours during the day with some overnight monitoring services. We've helped people with disabilities, a 54-year-old gent with Huntington's disease. We selected accommodation, introduced care, and that's still going after 4 years, and supporting his carers as well to make sure that he can have the quality of life that he requires and wants. We've had a client with macular degeneration. She's 92 years when she came to us, and she's now nearly 97. And we're just at the point of transitioning her and being re-engaged to move her into residential aged care. So then there's retirement communities as well, assisting couples to find the right retirement community. That can be challenging because it's very based on, you know, their capacity to pay, but also their choice. And then there's residential aged care placements and end-of-life care that we can offer as well. Just the next slide's got our contact details. If you've got any questions around Care and Living with Mercer and the portal, please reach out to us. If you want DR Care Solutions, which is a personalised service in my own business, our details are there. So I hope that's covered just about everything. I'm sure that if anyone has questions, please feel free to reach out and ask us.